Yes, good evening, everyone. Welcome to another edition of Microbiotics Bio Talk. It's been a while, it's been a week, and this evening we'll be talking about an infection or infectious diseases that is presently spreading through neighboring countries around Nigeria. That's anthrax. I think it has been the infection has been seen in Ghana, it has been seen in Cameroon as well. So, of course, since we share international boundaries, international borders with these nations, of course, we have to be on alert in Nigeria as well. So, anthrax is actually an infectious disease that is caused by an organism called Bacillus anthracis. It's zoonotic in nature. That means it can be transmitted to human from animals. So the organism causing it is actually a common organism. It's present usually in the soil and very stable there. And when herbivorous animal grazes on pastures, that's when they contract these infectious agents. And it is usually in the soil in form of spores. When we refer to as spores, we're talking about you can think about spores as eggs that are being laid on the ground that would only hatch when the condition is favorable to them. So basically we have three types of three ways in which anthrax can be contracted. We have skin contact, that's what we refer to as cutaneous anthrax. Then we have inhalation anthrax, which is through the nose being inhaled. Then we have gastrointestinal anthrax, which is being when you contract it through injection. So of course the anthrax infection can only be transmitted from animals. Humans can only acquire it from animal. There is no human to human transaction. No human to human transmission. Okay, so of course, the signs and symptoms are dependent on the route of infection most of the time. So you have the one of inhalation anthrax being different from the cutaneous one, and being different from the gastrointestinal anthrax. Gastrointestinal anthrax can be contracted through the ingestion of a contaminated and undercooked meat of infectious animals. Okay, so if you are buying meat, of course, especially the hides, I've been told that we should actually be careful of eating pomo these days. Well, I hope Nigerians will listen to that. But like I said, it's usually through undercooked meat, so you can definitely be very careful and very meticulous when you are cooking your meat so that you won't contract it. Oh, and yes, it's not only domesticated livestock like cows or sheep that you can get this that you can contract anthrax from. You can also contract it from bushmeat like antelopes and the like. So if you are going to be eating bushmeat as well, make sure it's very cooked and it's not undercooked. Once you buy it from outside, cook it very well, please. So of all the three major ways of actually contracting this infectious disease, the most dangerous way is actually through inhalation. When you inhale this particular spores, it causes a lot of damage. So most of the time, people who visit farm animals or animal farms are actually being asked to be very careful, especially if anthrax is being suspected to be transmitted within that particular farm. So be very careful about that. And the most common symptoms or a sign of anthrax is actually on the skin, cutaneous anthrax, which will show in form of a blackened spots on the skin. kind of a black spot. I'm going to show the image. The image is already shown in our videos. You're going to see that black spot. So it's usually starts in form of a bump, then eventually it starts to decay, then eventually it's to dry off. But once it's there, that means the person is actually contracted a cutaneous anthrax. Cutaneous anthrax can usually easily be gotten over, can actually recover faster. But it's, like I said, it's the inhalation, anthrax that is actually dangerous to get over. So okay, in terms of the diagnosis, of course, once you suspect that your animal or your somebody you know or anyone around you is infected with anthrax, please just contact the nearest health facilities. Like I said, I'm going to, like I usually do, I will attach these documents so that you'll be able to see the symptoms to watch out for. The initial symptoms are usually common symptoms that everybody can see around. That's you having a headache, sweating, fever, vomiting, chest pain, and non-productive cough. So, and it's actually common. But once you've seen the skin reaction, that black spot, that's usually the sign of anthrax. It may be. So contact the nearest health facility. They'll be able to do the required tests and pass of the person as safe or not. Of course, there are, apart from the diagnosis usually look like other diagnoses as well, a differential diagnosis. So because of the different ways in which it can get into the body, the symptoms can look like the symptoms of pneumonia, influenza, plague, tularemia, and of course, if even in some instances, it may look like that of a bubonic plague. So when anybody is once you see the symptoms that looks like the symptoms of this disease I mentioned, just get the person to the nearest healthcare facility so that they can do the proper test for the person, so that he or she will be declared safe to be reintegrated back into the society or will be quarantined. So the treatment, the management, of course, we have a lot of treatment regimen for anthrax, but you can definitely get it in the article that will be attached to the video, so that you'll be able to. It's actually very detailed, and it requires a combination of antibiotics, antitoxin, and of course the treatment of the symptoms, where you actually try to relieve the symptoms of the disease. And also, anthrax has a vaccine, of course. It's not just a vaccine, you have vaccines for humans and for animals. The one for the animals are usually the common ones. The one for humans are not usually given like that. It's usually given to some set of people who are at the risk of having direct contact with infected animals, like animals handlers, like those who work with animal hides, of course, veterinarians, laboratory workers, and of course, people who are usually on the field, like the military. Yes, because the military usually usually move through the field in the soil when they are going for missions. So you watch a lot of movies now. So they are also at the risk of actually contracting the Bacillus spores from the soil. So a vaccine is actually recommended for those who are at the risk of actually contracting the infectious agent. So there are other instructions given. You have the opportunity to read them at the on the article. But like I said, the cases of anthrax is usually being treated like about terrorist events. So you have to you have to be very, very careful in case you see somebody who is infected. You treat it to its utmost importance. It's a very serious infection which can easily move from 0 to 100 in terms of fatality. It's very rare. It's very rare, of course. And when it happens, like I said, people usually suspect about terrorism. So the healthcare workers are usually have to be very, very careful whenever they are treating patients. They are also very careful whenever they are interacting with animals, especially during outbreak. Point of note, please. We don't have it yet in Nigeria, please. It has not yet been declared in the country, so we are still safe, but we need to be on the lookout. So I'm going to stop here for now. Don't forget that if there is any additional information that you need concerning this infectious agent, this anthrax, you can get across to us. You can also reach out to any healthcare facility around you so that they'll be able to give you the required education. So, and this article is also, the article that is attached to this talk is also containing a lot of information that will prove very useful to you in case of necessity. So I'm going to call it an evening. Thank you for staying with me. Thank you for tuning in. We are going to be seeing very, very much, very, very soon. And like I always say, make sure that you take care of your health and stay safe. Please stay safe. If you are going to somebody else's farm, please cover your nose. Use your nose mask, okay? Anybody, if you have a business at an animal farm, please cover your nose. Take care of yourself. And your pomo, please. Yes. Yeah. Let me remind you. Your pomo. Don't take undercooked meats. Make sure that it's very cooked very well. So see you next time. Have a lovely evening ahead of you. Bye. She touches my shoulder while we talk, I got a chance. If I draw wood, call it an olive branch. You know what they say about the devil in idle hands. So I got my palm in the small of her back while we dance.